How's it going, everyone? I'm Lunarwolf, and I'm back on SurgerySquad.com for more surgeries. Don't worry, this isn't all I'll ever post. But I'm not an optometrist, and I'm not a dentist this time around. I mean, I am, of course. I'm a professional of both medical fields. But this time around, I'm going to be doing some cosmetic surgery. I'm going to be making people more confident about the way they look. So let's get right into the surgeries.
Welcome to Surgery Squad's virtual closed rhinoplasty surgery. I'm Dr. Susie. Today we will be performing rhinoplasty. It's what's commonly referred to as a nose job. In this cosmetic surgery, our patient is a young lady who's looking to change the shape of her nose. We'll perform a closed rhinoplasty procedure to reshape her nose into something she finds more appealing. Some surgeons will perform this surgery using a local anesthetic and sedation, which makes the patient numb and in a dreamlike state. I prefer to work with a patient under general anesthesia and completely asleep. What we're doing today is reshaping the bridge of the nose. Our patient feels it's too wide and doesn't like the hump on it. The thinning of the nose is called an infracture. I'll bet you can't guess what the widening of the nose is called.
An outfracture.
All right, I'll tell you. It's an outfracture. Some patients may also want the tip of the nose reshaped. That's called typoplasty. But as I was saying, this patient only wants an infracture and some reshaping. Easily done. To begin this procedure, we need to open the nostrils as wide as possible. We do this with a retractor. Can you place the retractor in the patient's right nostril?
Okay. Oh. Is this like a dinner fork? With only two of the little things. This fork is bent, too. How do you expect me to work with such inadequate tools? Just kidding.
Now with the nostril opened wide, we'll make an incision inside in a crescent moon shape. That will allow us to access the bones and cartilage that make up the nose structure. I've made the incision. Can you use the forceps to remove that portion of the nostril?
Of course.
Surgeons must be hyper-vigilant when doing this portion of the procedure, as it can damage breathing and sense of smell. To reshape the nose, we're going to chip off the dorsal hump with a chisel tool called the osteotome. We place the osteotome at the base of the hump and then carefully tap on it with a small rubber mallet. This has to be done very gently and takes a careful touch. I'll position the osteotome and you tap the end with the hammer.
Alright, does anybody get flashbacks to when you're working in a museum and you're like, I've got to place these fossils very carefully or they might break? I'm getting flashbacks to like a museum and just an employee just dropping of like a fossil, shattering it all over the ground. And now I'm scared of what I might do to this poor girl's nose. I'll just take off a little from the top, take a little from the sides. That might be a bit much. Alright, we're gonna give it a good old smack. We're gonna do this Mario style. Oh, that might have been too hard. Whoopsie. Oh. Yikes.
Now that the hump is loosened, we need to pull the bone and cartilage out of the nose. Use the tweezer-like forceps to slip it out of the incision.
Is this gonna make you sneeze? Is this tickling your nose? Are you awake? Hello? Guess not.
Now that the bump is out of there, we need to smooth the edges on both sides with a rasp. The space left by the bone we've removed is referred to as...
Hang on, you only smoothed one side, not the other. You sure you don't want to do that? We're the professionals. Guess
As an
not.
open roof. To close the open roof, carefully tap the osteotome along the path that I've marked. This breaks the nasal bones so we can reposition them. Tap the osteotome once each time I reposition it on the left and right nostrils.
Let's just beat this girl's poor nose into oblivion. Bah. Aw, we can't.
Now that the bones are broken, I just take my fingers and reposition them to close the open roof. Because we made such perfect breaks, the bones slip right into place and the nose is perfect.
Oh, that's some heavy
A
bruising.
few stitches to close up the incisions, and then we place nasal airway splints in each nostril to hold things in place.
I've heard taking those out is excruciatingly painful. I don't know why you'd go and do this willingly and have those ripped out of your nostrils, but it's up to you.
Steri-strips go across the nose, and an external nasal splint is added to hold everything tight. Our patient will have some bruising and minor pain for a few days. We'll remove the splints in about a week. Most of the swelling will be gone by then, but there can be a bit left for a few months. And there we have it. Thanks for coming by. Catch more of my great surgeries here at surgerysquad.com.
Alright, well, I'll see you in the next surgery. And here we are. This surgery is laser hair removal. And, as you can see, the hair we remove is going to be put to good use. As you can tell from this ad that we put up.
Welcome to Surgery Squad's virtual laser hair removal. I'm Dr. Jeff, and I'll be assisting you with this surgery today. Everyone gets hair where they really don't care to have it. Fortunately for all of us, we have the option of laser hair removal. Laser hair removal is a non-invasive cosmetic procedure that uses a laser to remove unwanted hair. The energy from the laser damages the hair follicle, which reduces the hair's ability to grow. Although laser hair removal is an incredibly popular procedure, not everyone is a good candidate. The best candidates are those who have hair that is darker than their skin. Individuals who have a darker complexion or lighter colored hair may have their skin inadvertently damaged by the laser.
Yikes.
These individuals may also need more treatments to get rid of the unwanted hair. Our patient today is a male in his 30s that wants to get rid of some unsightly back hair. As you can see, he is an ideal candidate since his hair is darker than his skin. I've already given our patient special goggles to protect his eyes from the intense light that is emitted from the laser. To get things started, we first need to shave the treatment area.
Shave? Why are we shaving it if we're gonna be using a laser to remove it? Look, you didn't do that in the animation of this procedure. Why are we doing this in this one? Gotta cover this forest really well. There's more. Hopefully this is the end of it. I covered a small slice in his skin. Well, oh well. I guess it'll get shaved too. That probably won't feel too pleasant, but what do I know? I don't shave. Gotta cover him real good in this. Don't want him slipping away. Still more. God, man. How hairy are you? I can see why you want the surgery all of a sudden. You're like an ape. A monkey. You got too much hair. Well, we're gonna have a good amount of wigs come out of you, dude. The bald people will thank you for your sacrifice, sir. You'll be colder in the winter, I'm sure of it. But hey, at least you're giving to those who don't have hair on their heads. Alright, I missed a spot. Like a gigantic portion under the sign. This is not how this works. It comes off cleanly with one thing. Let's move nice and slow and get rid of all that hair. Gotta get rid of all that hair. Don't worry about the shaving cream in it. That just makes for a more solid wig. Okay. Don't worry, we don't need to get rid of all the hair. We'll just leave some unsightly patches. We've got to get him back in somehow. Oh, nothing, sir. I didn't say anything. Yep, there's that cut. Just getting rid of all of that nice fur you had. Gotta get rid of the fur.
Great. Next, let's apply a topical anesthetic to the treatment area to reduce the amount of discomfort our patient may experience.
He doesn't need a full anesthetic. We'll just give him some drops. There, that's fine. Alright, that should be enough there. That should be enough.
Now that the topical anesthetic is applied, we'll need to wait about 30 minutes or so for it to take effect. The anesthetic has set in. It's time to zap some follicles. The most important step of laser hair removal is to get rid of the unwanted hair using our laser. As you guide the laser over the treatment area, it shoots tiny bursts of energy which travels through the skin and is absorbed by the hair follicles. By doing this, we're damaging the hair follicle and reducing any future growth. Why don't you try it out?
Okay. I like how we're just turning this person's skin red as we're doing this. I made a smiley face. Don't worry, he probably won't notice. Make sure to get that cut really nice and energized. It's really good for the skin. It's really great for healing process. What, is going to come out splotchy and incomplete? Of course not. I'm a real cosmetic doctor.
Perfect.
There we go.
Are you sure you haven't done this before?
Of course I have.
After the procedure has been completed, our patient's skin may appear red or irritated. Luckily, this lasts only a day or so. It's extremely important to avoid the sun or use sunblock for a few weeks after the procedure, and avoid any plucking or waxing of the treatment area.
Ooh.
Immediately after the treatment, our patient can apply cold compresses to the area to help alleviate any discomfort. Within a few weeks after the procedure, he may notice some new hair growth from the treated hair follicles that were inactive at the time. Because of this, our patient may need to undergo multiple treatments. Most individuals receive a total of 6 to 8 treatments before achieving desired results. The overall results of each treatment rely greatly on an individual's skin tone, hair type, and growth phase of the hair within the treatment area. Laser hair removal may not prevent hair from growing completely, but after multiple treatments, it can significantly reduce the amount of unwanted growth.
Of course.
And that's laser hair removal. I couldn't have done it better myself. Why not try your skills in another surgery here on SurgerySquad.com?
And our wigs are completed in a couple of weeks. So I'll see you in the next video. Gotcha. It's another surgery. And this time, it's laser tattoo removal. Let's see if we can do this. Of course we can. We're a professional.
Welcome to Surgery Squad's laser tattoo removal. I'm Dr. Susie, and I'll be assisting you with this procedure today. According to a recent poll, over 50% of those with tattoos want at least one removed. They cited being too young when they got it, a new career, or significant life changes, such as divorce or childbirth, as reasons why they no longer want them. Luckily, there's laser tattoo removal. Laser tattoo removal is a procedure that uses a powerful laser that reacts with the ink of a tattoo to break it down into tiny particles. The laser directly targets the tattoo pigment and leaves the surrounding skin virtually untouched. After the ink is broken down, it is removed by the body's immune system, creating a natural-looking fade that typically only time or sun exposure would produce. Although laser tattoo removal is considered highly effective after multiple treatments, those interested need to keep in mind that yellow, green, and fluorescent tattoo inks are much more difficult to fade. Our patient today is a male in his mid-20s that got a tattoo on his calf when he was a teenager. Now that he's older, he doesn't see the tattoo as being so attractive anymore. In fact, he's come to us to get it removed. So let's scrub in and see what we can do for him. Before we begin, we need to go back in time to the day he picked out his tattoo. Help him pick out a real winner.
So we get to
Use
pick
the arrows
tattoo.
to scroll through the tattoos. Click Choose when you have made up your mind.
Okay. Roll them bones. That's interesting. That is truly ugly. That's the only word that can be used to describe this. I can understand important dated tattoos, like the loss of a loved one, or an anniversary, or someone's birthday. I don't know why that would be a tattoo you'd want, but I mean, it's better than this. I mean, dated tattoos, there's just something about them. It just leaves a sour taste in your mouth when you look at them. I mean, it's not the best tattoo I've ever seen, but it's at least not the ugliest one on here. Oh, that is most certainly an ugly child. I like how it even has the detail of all this hair being pulled up in a ponytail and just not having enough, and just that hairline. Ugh. Oh, we get to type something. Of all the things we could type, I wonder what it is we should type. Said it was a male. So, oops. I hate this. No. Ah! The boys. I like how there's no indication of who these boys are. Let's be honest, the only tattoo I would ever have is probably the chameleon, in all honesty. But the one I would want taken off most is this one for sure. So let's choose it.
Yikes! She doesn't really look like that, does she? Let's make that tattoo disappear. During our patient's initial consultation, it was recommended that he take a non-aspirin pain medication prior to the procedure.
That isn't actually necessary. We can probably just throw some ice on there. It'll probably be cold enough that you probably won't feel anything. You'll probably need it afterwards, of course.
Reduce any discomfort he may experience. Other than that, there really isn't any other preparation needed. So let's get started. A lot of patients describe the pain from the laser as feeling like 100 rubber bands striking the skin at the same time.
That would actually be pretty unpleasant, I must admit.
To begin the procedure, we'll need to place a cold compress on the tattoo for a few seconds. This will help reduce the pain caused by the laser. Go ahead and place the cold compress on the tattoo.
It didn't just spawn in, it came flying at me into my hand. Instant Chill Pack. Sounds like the name of a band or something.
That will do. Now we need to use the laser to fade the tattoo. Different types of lasers react with certain colors of tattoo ink. One laser might work perfectly for reds and oranges, but not so great on greens or black. So we'll use a variety of lasers to get the desired result. To help relieve some of the pain associated with the procedure, we'll also use a machine that blows icy cold air on the area being treated. Let's start by targeting any red or orange ink areas.
This kind of looks like a needle I'm going to jab into his leg, kind of.
Next up is green, blue, or other darker colors.
Oh, this is just getting worse as it goes on. I don't know what color those eyes are, if they're just black or if there is any color. It's just too small.
Finally, we'll remove the black.
Oh, I like how I missed the hairband. I didn't think it could get worse than this, but it did. I honestly didn't think it could get worse than it already was, but this is not an improvement.
Now that we've completed the first treatment, we'll need to place the cold compress on the treatment area.
I can do that You don't need to tell me.
You did great. Our patient is ready to go. Immediately after each treatment, the tattoo may feel sunburned, and it is extremely important to keep it covered until it heals. If our patient fails to do this, both his recovery and the results of the treatments may be negatively affected. Roll the bandage over the treated area.
Yeah, we ought to cover this. There's
As
nothing
stated
about that.
earlier, our patient's tattoo will only begin to fade
I would
after
want
multiple
to
treatments. So he shouldn't expect the tattoo to go away during one session. While the tattoo may not be completely removed, it should be lighter and much less visible than before. And that's laser tattoo removal. Well done! Why not try your surgical skills in another surgery here on SurgerySquad.com?
And that's their 3 surgeries for today. I'll see you all in the next video. But until then, if you like it, leave a like. If you like my channel, subscribe. If you want to, leave a comment. And until next time, I'll see you in the next video. Bye!